Joining us now, Dr. Stamatia Destounis, I hope I got that right, Chief of American College of Radiology, Breast Imaging Commission, and a breast imaging radiologist at the Elizabeth Wende Breast Care Center in Rochester, New York. Doctor, good morning. Thanks for joining us here, and we appreciate you taking part in our Jam Media Solutions National Breast Cancer Awareness Month programming. We're doing all month long on all of our channels, social media, and our radio stations, and obxtoday.com and voiceofmuscatine.com. And we want to get right into it with the challenges that COVID-19 has been offering in healthcare across the board, obviously. And one of those big things is breast care and breast health. And one of the questions, I just want to jump right in. Can someone get a mammogram if they've had COVID-19 or are currently diagnosed with COVID-19?
So good morning. Thank you for the opportunity to speak to your listeners. I think, we're all living in different times now, and everyone is practicing great safety measures. So if you've had a diagnosis of COVID-19 months ago or weeks ago, or a more recent diagnosis, it would be best to speak to your primary care doctor and find out if it's safe for you to go in and have your screening mammogram. Having COVID months ago or weeks ago, there's no reason for you not to be able to go in now. But if you've just been diagnosed, you may want to wait so you're feeling better and it's safe for you and it's safe for the other patients that are at the center that you will go get your imaging. So speak to your primary care doctor, speak to the radiology facility that will be doing your mammogram to make sure it is a safe environment for you to go in and then go have your life-saving screening test. Screening mammography is important, so you shouldn't skip it. They may tell you to wait a few weeks. If you've just been diagnosed, that's fine. Reschedule to a few weeks later and then go in and have your mammogram.
And this is a challenge that's been going on now. We're going to be entering year 3 of just general health care. And people being concerned about that because, and my wife works in healthcare as a pharmacist. The last place you want to be when you're not well or other people aren't, a hospital is like the last place you want to go, our healthcare facility, especially if you're worried about what COVID-19 could mean for you. And you just mentioned how important it is to continue to get those annual mammograms, whether you're a man or a woman, obviously, because men can get breast cancer just as much as women can. But it is, you just said, but it really is important to continue to get those yearly checks, even though we still are dealing with COVID-19.
Exactly. So if you have a concern, certainly, definitely most important that you reach out to your primary care doctor if you feel a lump or any changes in your breast tissue, if you're having breast pain, and then they'll schedule you for an exam to come in and the mammogram will be included along with other testing. It's important you follow through, especially if you have a concern. But even if you don't, and you decided, okay, 2020 with COVID, I'm just not going to go this year, but now I think I don't want you to skip another year. Go in and have your mammogram because we want to detect cancer the earliest possible. By skipping the mammogram for a few years because of COVID, we're going to find cancers that are larger. They're more difficult to treat. The prognosis may not be as good. You may need more surgery, more aggressive surgery, but also more aggressive treatment after surgery, the radiation, chemotherapy. So we want to find that small when it's going to be least affecting your life. And we want you to live a long, long life. So the earliest we find it, don't skip your mammogram. Now, men do get breast cancer also at a much lower rate than women. But if there's a family history, if there's a genetic mutation like the BRCA genes, definitely those men also have to have that discussion with their doctors and go get checked. They may need to be screened also in a yearly situation, right? Just like women. Mm-hmm.
There's updated guidance from the American College of Radiology and Society of Breast Imaging, especially for 2 key demographic groups, those being minority women, but also those people of color and transgender people. Why is that?
So, we have found out in the research that's being done for the last several years that African-American minority women, are much more likely to have an aggressive breast cancer in comparison to white women. and also before the age of 50. And they're much more likely to die and have a poor outcome than white women. So, and the reasons for that may be genetic. So some of this is hereditary. Some of this is the type of breast cancer that African-American women are more likely to get, which are these triple negatives. They're more aggressive, and women just don't do as well. So some of it is genetic. Some of it is the histopathology of the tumor itself, but we want to make sure that the minority groups are going for their screening, because we have found that minority groups are less likely to go in every year, less likely to follow up with treatment options. So they present with larger cancers, they're more difficult to treat. And then even the follow-up is a bit more of a challenge. So we want to reach out and educate that the different minority groups need to go in and get screened. Now, the LGBTQ and the transgender community, that's a tough group because they may not feel welcome to go into a radiology practice to get a screening mammogram. They may feel uncomfortable. So we need to do better to make them feel comfortable about coming in. If you're a biological male transitioning to a woman, a female, you're getting hormones, that may produce breast development for you. So now you need to consider that and not ignore that, and you may need to be screened. If you're a female, biological female transitioning to a male, but still have breast tissue, still have ovaries, you may still need to be screened on a regular basis because you're still at risk for breast cancer. So we don't want to ignore those reasons. And we want to make a pathway that's easy for all people to be able to get screened and get a screening mammogram, because we want to detect breast cancer early. And it is very treatable. It's a common disease, but it's a very treatable disease, especially when found through screening.
Another barrier, if you will, to getting regular health care in general, but especially with regards to mammograms, is the rural-urban healthcare divide. We really experience that in both our coverage areas in Eastern North Carolina and also in the Muscatine, Eastern Iowa,
Right.
Western Illinois area, with regards to what people perceive as barriers because of the distance they have to travel for their health care. Is that something that, your group and with the American College of Radiology and other groups are trying to overcome? What are some suggestions you have for people who may feel like that there's this rural, or feel like that they're, because they live somewhere, that it takes a while to get there? Are there some resources they can tap into that you're aware of?
Yeah, so I mean, mammographySavesLives.org is a great resource about breast cancer detection, diagnosis, risks, benefits. But I do think that women that may not live in, New York City, let's say, and they need to have care, to communicate with their primary care doctor. Their primary care doctor is going to be able to identify a center, a radiology clinic, or even a mobile, because now many facilities are offering services through mobile. So, to reach women that are unable, because they're working Monday to Friday, it's difficult for them to get an hour away to drive, or half hour away. So we are thinking out of the box. And there are different solutions that we are developing. And that's the one thing with COVID. We realized that, although we're all socially distanced, it's brought us closer together through computer, through different ways of education and reaching people. So I do think that accredited facilities that perform good mammography are available, not just in large cities, but also in the small towns, and women should research the breast imaging center or the hospital radiology department they're going to find out, do they have the latest technology? Are their radiologists accredited and certified? So you can do some of the legwork, speak to your doctor, speak to other women that have had a mammogram, and do your own homework a little bit. But there's a lot of tools, and there's a lot of things out there available for women to get their mammogram now, even in a small town that's remote.
There's a magic number when it comes to when women need to start getting their annual mammograms. What is that?
So if you're average risk, if you have no strong family history of breast cancer, if you haven't had cancer before, if you haven't had any precancerous cells at a needle biopsy, so if you're an average risk woman, start at 40 and every year and continue as long as you're in good health. There's no upper limit. We don't believe that at 75, just stop getting screened. Women that are 75 years old are very, very full of life and take care of their families and work, and they're very productive. So we want women to continue getting screened as long as they're in good health, start at 40 and every year.
And finally, because you got to go, where can women learn more about mammograms, even breast cancer screening, dense breasts, all these different topics?
Yeah, mammographysavesliveslives.org. No space in between. Check that website out. Has a ton of great information about everything you want to know about breast cancer risk, about dense breasts, about high risk, about other technologies, about screening mammograms, and the importance of mammography.
And finally, always do this when folks come on from all over the country. Have you ever been to the Outer Banks?
I have not, but I would love to come and visit, but I haven't.
Okay.
But I want to.
All right. Awesome. Awesome. Dr. Stamatia Destounis,
Yes.
Chief of the American College of Radiology, Breast Imaging Commission, and Breast Imaging Radiologist at the Elizabeth Wende Breast Care Center in Rochester, New York. Thanks for joining us.
Thank you. Thank you. Thank you for the opportunity to speak to your audience, and have a good day.